managed and privately owned sites and PCPs. But it's also important because there must be discussions around monitoring and compliance to legislation. And also we are going to allow for various organizations to make their brief input so that we can be able to get a sense from the different sectors, from the different organizations on what they are doing. But in the main, the presentation that we are going to receive from PDE would be on the ECT development and in terms of infrastructure, the curriculum delivery, the number of learners, some achievements, the challenges that have been faced, what are the mitigations that are there, but also to touch on the key thematic areas that have been alluded above. Now, as when we stated, when we are therefore requesting that you respect the fellow speakers and also respect the setting in itself. Just briefly, that's the main issue that we are here to discuss today, and for 25, we began the process of looking at the provisioning and support for early learning, because that was the primary reason why ECT functions were transferred to education, so that they can be focused on early learning, which was not there when it was still with social development. So we started that process, and in 25, 26, because of the access issues as well, we started implementing from the Department of Basic Education, the Banapili Mass Registration Drive, and we can safely say to this date, we are, those two issues, the Banapili Mass Registration Drive, we are continuing driving that program. We are continuing with the early learning programs and early stimulation,
And the third part to that is because we can't do it alone, we also, tap onto our the ECD social compact, and we will see as we continue with the presentation. Just for purposes of this presentation, we just want to indicate that we will be using terminology like early childhood development, and our understanding it would then be that it refers to the process by which children from birth to 9 years grow. So that's the whole spectrum of early childhood development. Although we then, categorize in education, then we will take birth to 5 or birth to school going age as ECD, and then grade 1 to grade 4 would be then in the primary schools in that way. So that would cover, but in terms of the broader terminology, that's what it means. But I want to introduce a new terminology that I will be using or referring to from time to time, which is early learning programs. Because when ECD was brought to us from social development and from the Children's Act, the terminology used there is partial care centers. But because we want to, bring up the learning part of it, and the Department of Basic Education is moving towards the change so that it emphasizes the learning part of it. So hence with the early learning programs. So early learning programs would be the facilities where the early learning and the early stimulation is taken. Or non-center based, which would include the play groups, toy libraries, and home-based. And the other aspect that I would be referring to a lot is the e-cares, which is also a new thing since the ECD came to education, and that stands for Early Childhood Administration and Registration System. That is a system to facilitate the applications for registration, and it will also be developed further to also facilitate the applications for subsidy. To also remind us that the whole education roadmap in our GDE strategic areas for 2025-2030, early childhood development is strategic area number 1. So there are others, but the first one is early childhood development. Just to touch on the landscape is that currently the way we are structured in the Gauteng Department of Education for ECD is that we have a birth to 4 years, and then we have the grade R. The birth to 4 years is regulated by the Children's Act 38 of 2005, and there's also a national integrated ECD policy 2015, and in terms of the early learning curriculum, it would then be the national curriculum framework, which I need to emphasize that it is a framework. It's not instructive like the CAPS. Then the grade R, as we all know, it is regulated by South African Schools Act as amended, and the curriculum and assessment policy statement, which is CAPS grade R to 3, which is its foundation phase. And we find the grade R, mostly we will find them in public schools, and that's where we want to see most of them moving to, but we also find them in private independent schools, and there are early learning programs, in other words, ECD centers that are offering as we speak. And I indicated earlier on that our early learning programs, it's center-based and non-center based. As we continue with the landscape, we just also want to remind, which I've always been presenting, that before we started, we took over the functions, there was an ECD survey 2021 that was conducted that indicated that in Gauteng we have 10,376 ELPs, that is the early learning programs. And of those to date in our master list, we have 3,098 that are registered, covering about 11,200 practitioners and 134,000 children. And we are sitting currently with more than 7,000 that are not registered. However, through our mass registration drive, we have managed to get 4,063 that applied in the e-care system and successfully achieve the bronze certificate, which does not mean they are registered or they are complying, but it means we know them now. We are going to work with them and assist them to move to compliance and get registered. We also want to indicate, so that's the issue about the access. And in terms of quality in that space is that where recently the Thrive by 5 index for 2004 has been released. The results have been released, and which looks at those learning domains that are associated with academic achievement in foundation phase. And that Gauteng currently, from that study, is that 56% of our children are not on track when it comes to gross motor development, and 64% are not on track when it comes to fine motor coordination and visual motor integration. And fine motor coordination, and those two elements, gross motor development, fine motor coordination, they are very key in developing the children's cognitive, for the cognitive development of children. If children are not on track on that, it creates problems for children to learn and to be able to read when they reach age 10. So if we have 64% of them not on track, and remember, these are the ones that are accessing early learning programs, and there's still a lot that is not accessing. So these numbers are the ones that are driving us to put in place processes and programs that would start addressing these issues. And in numeracy, 63% not on track. Cognition and executive function, 59% not on track. Emergent literacy and language, 41% not on track. So that brings us then to what drives us is this problem statement that most of our children, they start school having early learning gaps, and these early learning gaps, they keep widening throughout their schooling journey. And that's the problem that we want to solve. And the components in solving those problems is that we need to close the access gaps, we need to close the early learning gaps, and the most important player in this is the practitioner practice standards in the early learning programs. So that is what we are, that's how we have organized our work. So in terms of what then are we doing, we have set ourselves that for 2026-27, we want to focus on those issues, on the access, on the quality, capacity building, and social compact. And I will unpack that in the next slide. So as I said earlier, the specific areas that have been raised will be dealt with then in these aspects, in these focus areas. The first one being access. So where we will be busy with our Banapili mass registration drive. I have already indicated that we have more than 4,000 that have bronze, and now we're going to be helping with them to ensure that they comply so that they can qualify to either silver or gold status. And it's all systems goals. We have trained all the social services professionals, and I think on Monday last week or Tuesday this week, National have sent that we are now live. The system is live, so we will be starting that process. So and in that process, we will be working in collaboration with municipalities. We have had a number of consultations with various municipalities, and they are all we have all their buy-in so that we help them to comply. That's a process that we're going to start as of now this week and leading to the next financial year. And that is part of access. So the second part of access is that of the funding that which is a pro-poor, using the pro-poor policy. So the funding, I will need to explain that it is for the children, not for the ECDs centers or early learning programs. It is for the children. So there is a subsidy guidelines that indicates the formula to get those children that are poor. But the model is that it's 24 rands, which is a new funding rate of funding. It has been 17 rands, but now it is at 24 rands per child. standards, we actually find them in the Children's Act, which refers to the safe environment for children, proper care for sick children, adequate space for ventilation, safe drinking water, hygiene and adequate toilet facilities, safe storage, access to refuse disposal, employ people that are trained and skilled, provide a program that is appropriate to the developmental needs, hygiene area, a measure for separation of children per age group, the drawing up of policies and plans for emergency, for healthcare, for facilities, and the service should be accessible to children, and the facility must meet the needs of the children. So that is for just for the structure where they taking place. Then for the program, we want the program must aim at helping children to realize their potential, caring of children in a constructive manner, providing support, ensuring development of positive social behavior, respect for and nurturing of culture, spiritual dignity, individuality, meeting of emotional, cognitive, social, physical, spiritual, and communication development needs of the children. So because we have the National Curriculum Framework, and in the Children's Act, there is no reference to that, but in the amendments, these are the things that we're beginning to put in, so that then we can look at all the aspects that are in the National Curriculum Framework and also put them in. But what we do now, we do use those the National Curriculum Framework, but I'm just indicating that we also have made that point in the amendments as in the Children's Amendment Bill. So with regards to the relationship between government-funded ECTs and privately owned sites, I just need to indicate that the ownership of all ECT programs or early learning programs, as we would be calling them, the ownership is either private or NGO owned or community-based owned. There are none that are owned by the department in the current state. So what happens is that all those that want to benefit from the subsidy, they would apply so we normally issue out an advert and they apply, and we put in the criteria based on the subsidy guidelines, and we conduct those paneling processes, make recommendations for eligible ones, and then we monitor those that are receiving subsidy on a quarterly basis, because that is a requirement to activate the tranches, because the allocation is done then, or the payment to the early learning programs is done on a quarterly basis in 4 tranches. So to activate the next quarter's tranche, we need to have monitored, they need to have produced the financial statements and the receipts, proof of all the expenditure that they've made, that it is in accordance with the service level agreement. And all registered early learning programs are monitored for compliance with norms and standards. So when it comes to norms and standards, we monitor all of them. We don't differentiate whether you receive funding or not. And then the ones that are funded, there's an extra layer of monitoring, which is on whether they are spending the money in accordance with the SLA that they have signed. So, but the ownership, it still belongs to them. There's nothing that says when they are funded, now they belong elsewhere. They still belong to that organization, and we monitor them in that way. So when it comes to quality, then I've mentioned a number of times that we have a national curriculum framework, and what we are doing, we're ensuring that there is that curriculum continuum from birth to grade R in terms of our scope of work as ECD Directorate. So we have we have 2 sets of curriculum: the national curriculum framework and the CAPS grade R to grade 3. And we implementing those. Now, in terms of the National Curriculum Framework, it has those 6 early learning development areas, which is what we said we want to put in the we have made inputs in the Children's Amendment Bill so that it's covered there, and we are able to monitor whatever program, because there are different programs. Other people are using Montessori, other people are using Reggio Emilia. So, but these are the things that we want to see in early learning program in the early learning centers. Doesn't matter which model of curriculum are you using. What we are doing currently as a department, we're focusing on, based on what I've indicated earlier on the issues that came out of the Thrive by 5 index. We want to focus on the mathematical literacy, and we have structured it such that it is family mathematical literacy, so that we do it at the center level, but it extends to the family, so that stimulation goes on. Early literacy, language and communication, same model we'll be using. And we're going to be doing that in selected early learning programs based on their budget availability from our side. But I do want to indicate that and I'll speak about this later as well, that we are building partnerships with a whole lot of other stakeholders, so that we can have more and more of programs in the ECD. We have the pre-grade R science program that we run with Saibono, where we take children. We have developed an area for pre-grade R for birth to 4 years children, and then we transport them to Saibono as well. We are implementing Sports Wednesday through physical education and Wellness to Life, and that is a very successful program that brings this gross motor skills and fine motor skills in the centers. We have programs on play-based learning to improve the practice for the practitioners on play-based learning, that it is intentional and it has outcomes, and it's not just done for the sake of doing it. And we are providing resources. We have started the process of ensuring that every center that is registered, that they received a startup kit kind of, that is basic minimum resources. So we're providing that. We also have direct learner support. That's where we get them to come. Last year we had a successful Olympics, mini Olympics, ECT mini Olympics, where a number of ECT centers participated and children were displaying, their talents. So those are one of the direct learner support. We are planning this year to have projects that will come out of the ECTs to see how the programs that we be putting in this year, how the learners would be performing at the end of the year. The skills, because they need to show those skills that they've acquired. One of the areas that we are focusing on in the Birth to 4 is the early identification of learning barriers and early intervention. We are doing this in collaboration with the Department of Health, but we are also partnering with other partners that are working in that space. So then the other part is the Grade R part, which is the curriculum and assessment policy statement with those 3 subjects. And we are helping our Grade R in community-based. We have provided them with the policy statements, the CAPS policy for Grade R. We are supporting them on all those 3 subjects. We have a program which we call Grade R Mathematics and Home Languages Improvement Program. We have that program. We have implemented it in the public schools, and since last year we have started implementing it in the ECT centers, community-based. So the teachers from there, they come, they get all of that. Everything that we did there, we give them the training, just-in-time training, so they come and they go and implement, come back, go implement. We give them resources that goes with the training manuals and so on. And they're doing beautiful things in those centers when we go visit them. We can see the evidence of that. The Wellness to Life program, as I said, which is part of the Sports Wednesday, and the indoor and outdoor resources. So this is all that the dosage that we are providing to our early learning programs that are community-based. In terms of the capacity building and professional development, we have, every year we take ECD practitioners, about 500 based on the budget availability for the qualification FETC, ECD, and QF level 4. And so now we have a cohort that would complete, and then next year we'll take another cohort. And we take about 1,000 practitioners every year, where we train them on the implementation of national curriculum framework, that to 4 years. We will be adding the family literacy and early literacy for this next financial year. And the grade R practitioners in the ECT centers, early learning programs, as I indicated, we're providing them with that full program on grade R, maths and home languages program. And all the resources that we provide in the centers, we do the mediation. So they would come to the workshop and we mediate, and we also taking them through the early identification of barriers and early intervention, so that they are able to identify and they know what to do once they've identified. So we're also providing that to them. The next one is on public schools. And this is the last part on the ECT Social Compact, which we are, we want to put more emphasis on, because there are various departments, NGOs, NPOs that are in the sector, and we want to make sure that we improve on the coordination so that we have well coordinated activities in the province, and our programs, they have an impact because we are more coordinated. So this comes from the National Integrated ECT Policy 2015, that we have to work together and have an integrated approach to a child's development. So in our social compact, we have municipalities that we work with on the mass registration drive. We want to streamline processes with them. We are sharing data, we are co-planning, we are co-visiting, doing joint visits. Other government departments, we are working with them based on their roles, the health, social development, and all of those, home affairs, you name them. Now, the ECD forums, that is an aspect that we want to elevate in this coming financial year. We have realized that there's a gap, and that gap has created a situation that looks like there is no working together between the government and the practitioners down there. So we want to have a special, we do have an intersectoral forum, but we want to have a special structure with the ECD forums themselves. So where we would come and, share information, but more than information, do the capacity building. We realize that there's a lot of gaps in terms of the understanding between ourselves and the ECDs, and we want to close those gaps. So we want to turn some of them into capacity building programs so we can understand the issues from the ground, but we also give them an opportunity to understand the operational framework, because we operate from what the legislation says, what the policy says. We don't operate from the emotions and the feelings and the love and the passion, so, and in most cases we realize that there's that disjuncture. So we want to create this structure so that we address those things and get to the core of understanding how we work together, what is the modus operandi. We are currently also looking at partnerships and with a number of organizations. We are in the process of developing these partnership agreements on various aspects of the work, because we can't do it alone, and it's exciting. I mean, we've got on Friday last week, no, was it Monday or Tuesday? We had a meeting with Richard Maponya Foundation, which is going to take 150 ECDs in the Soweto area. So they will be focusing on that Soweto area. So that's a brilliant move for them. So we want to partner, so that what the importance of partnering is so that they do what, work within the government's strategy, and we are able to jointly plan, and we know that when we report on all these things, and there's no under-reporting. It should not look like in Gauteng they only trained 500 ECD practitioners. The other week we went to early learning care. Is it early care? What's the name? Where they were graduating 300 ECD practitioners. And so those are the things that we want to do together, so that when we report on all these things, but we work together even on, developing the plans. So partnership is one of the things that we're doing. In the intersectoral forum, we will continue to do our quarterly meetings where we bring everyone under one roof. And each and every one of us, that session would be used just to say, what have you done? Where are the gaps? How do we close them? In the next quarter, what are we focusing on? So all of us move in that direction. So we are, as a department, committed to improving that coordination and managing that space of ECD stakeholders. With that, then I want to thank you.
No, thank you very much, Mama. I think that was quite insightful, and it will assist in terms of the discussions that we'll then receive from our stakeholders. With that being said, colleagues, I don't want to be long. This, in the main, is a program that we are calling for you. We have received some of these presentations as the portfolio committee. So I'm going to allow for hands that want to engage, maybe ask questions, any comments that you would want to make as well. Do we have hands on the online platform as well? Do we have any comments? Yes. If you can just go through the comments. Okay.
Chair, there's a good afternoon, good morning, colleagues, good morning, honourable members. Chair, there's a comment, it's from Moipone, with regard to the municipal EHPs. What measures are in place to ensure that the various municipalities work from the same checklist when assessing the early learning centres? The norms and standards for compliance tend to differ from one municipality to another. Is there a standard document for all to use, similar to the registration process? Thanks, Chair.
No one could hear you. If you could just increase the volume.
The volume. Okay, thanks, Chair. It's from Moipone. With regard to municipal EHPs, what measures are in place to ensure that the various municipalities work from the same checklist when assessing the early learning centres? The norms and standards for compliance tend to differ from one municipality to another. Is there a standard document for all to use, similar to the registration process? Thank you, Chair.
Okay. I just want to check if there's anyone else in the House that wants to have a question or a comment. Okay. Please come in.
Good morning to everyone. My name is Palisa Jaji from Motewa Training Institute Trust. What I'm about to say is just a comment and to applaud the Department of Education in working together with the municipality. That is a great thing to do, because of we've seen in the past the misunderstandings that have been there when departments try to work with the ECD then the municipality has its own mandate, the department has its own mandate. When one comes and say, do this, then the department comes again and say, do this. So this joint monitoring and evaluation process that will be done jointly, it will really bring a greater impact into the ECD programs, because of a department and the municipality, they will be speaking in one voice other than operating in ISO. Thank you.
Well, thank you very much. Let me give it over to you, HOD, to just, oh, there's another one. Let's allow them to speak. Are they able to, yeah. SA Montessori Association online, they'd like to have a comment. Please go ahead.
Thank you very much for the opportunity. I have 3 comments. I just want to reiterate the previous comments about the municipalities and the norms and standards, as well as the checklists that they are using. It is causing extreme havoc on the ground because they don't speak from the same hymn sheet, so to speak. I also would like the presentation, the presenter made a comment on, I think it was slide 4 with the ECD landscape. And I just want to confirm that what I heard was not correct. What I heard is that the intention in the future was that grade R might not be part of the ECD. So in other words, standalone ECD centers would not in future be able to offer grade R. Is that what I heard, or is that incorrect? And also, is there any opportunity for collaboration in training with Montessori training centers for the ECD platform? Thank you, Chair.
Okay, thank you very much. There's another hand again online.
It's a comment as well from Ipileng Masala. Please share the selection criteria for ECD level 4 training for 2026. Where do practitioners find the information to apply? Thank you, Chair.
Okay, let me allow Member Mkwanazi to come in.
Thanks, Chair. Thanks, the department with the presentation. I still need a clarity about the qualification that they are using to hire grade R practitioner. They still have matrix, diploma, B.Ed, and then because there's a lot of still confusion in the ground. When I was listening the presentation, it's differ with the things that are happening in the ground. Exactly what is the total number that the practitioner must have in the class? In the class, and then the number, also the number of learners, the number of learners, absorption of practitioners in the department and the district. Also, remember there was first we used to have that the SGB, the one that are in charge. Some of the schools are still using that, but some of the other schools, if they want to, they said no, that now the grade R is no longer in the SGB, is migrated to the department. But it depends with what issue that has been raised. If the issue is maybe favor the school, they will say no SGP. But if they don't want, they say it's migrated to the department. Because the problem that the school are facing, what the department is saying is differ with the district. Sometimes I wish if we are having meeting like this, we have district also to part, because those IDSO that are working in with the schools, they are doing their own things in the ground. It's not the same things that the department is telling us. Also, okay, I heard there's a director that is monitoring the IDSO, but where is maybe their accounting, but exactly in the head office, the person that is the one is accountable for grade R, then exactly, I think the schools, they need those people. And then also the documented it, guys. You always, if something that is happening, today we are using a different document, tomorrow is another, like especially if there is some posters, if the poster, they want to change things, they always they bring the act, the new act every time, if there is a challenge. But if there is no challenge, everything's fine. I don't know what exactly. I think also again, when you are, whatever that you are, trainings that you are said you are providing, the educators must also provide that to the SGB, because at the end, the people are sitting in the interviews, they are the SGBs. Like example, if you are having a poster, like a HOD or permanent, let's say a permanent poster, you always call, or a teacher or a HOD or principal, you always call the SGB to come to the training. But when it's coming to grade R, I never had any training that you call the SGB and train them with what that is a document they're supposed to check, or the candidate is supposed to have. Because there's some of your documents saying grade 12. Today is now is diploma and BE and BEd. That is causing a lot of confusion. Can you please, when we start in 2026, we start with a correct document? Also, in your training, please involve SGBs, because the problem at the end, the SGBs are the one in the ground, are the one also having a problem. Also, when maybe there is a confusion between principal and the SGBs, and also the principal, they always bring the new document if they are not happy with the decision of the SGB. Before, they don't bring it, but after, they will bring the document if the principal want to dispute the whatever process that has been taken. Thank you, Chair.
No, thank you very much. There's just a follow-up or an update on one of the comments that were made earlier from Montessori Association. If we can just maybe give them the platform again.
Thank you, Chair. I'm sorry for butting in again. I would also like to get clarity on the qualifications. In our Montessori landscape, our mixed ages has ages 3 to 6, which then includes the grade R child. So most of our Montessori standalone ECDs have the grade R child within the early childhood development program. And it requires all of our guides or the teachers to upgrade their current national curriculum framework level 5 diploma qualifications to what we were first told to a NQF 6, which is the grade R, but to the best of my understanding, this is no longer available. And so now they all have to upgrade to a degree B.Ed foundation. So I would just like to get clarity. We attended the Western Cape ECD stakeholders meeting in Mossel Bay in June, and the presenter there implied that standalone ECDs in community centres can still offer grade R with an NQF 5 qualification. So we need clarity on that. My second question is regarding the Children's Act, which is under amendment at the moment, and we all understand how tedious and long it takes to change legislation. But in the meantime, there needs to be way more clarity on how things are happening, why it's happening, the processes, the procedures, the guidelines, so that the entire ECD landscape is clear and can prepare ahead of time, which would make the Department of Basic Education ECD forum or the job so much easier. If everyone has a clear understanding of what is expected of them, they can prepare properly. I think it would just streamline things. So yeah. Thank you.
Okay, thank you very much. Let's welcome the MEC who has just joined us. Thank you, MEC. We were told of your prior commitment, and thank you for making the time to join us. I just want to make a couple of comments. Really, I think, is everyone covered? I don't want to close anyone else out. Okay, I'm gonna take the hands starting from my right. 1, 2, 3 in Tatemaimela. Yeah, let's take those 3 hands. If we can be assisted with the mic, please.
Thank you so much, Chairperson, for the opportunity. My name is Valerie from Grow Great. First of all, I would like to applaud the Department of Education for the work done so far. Yeah, I just wanted to make a comment with regards to what Ms. Lobatla was saying in the presentation around collaboration and yeah, just working together. I want to know if there's a clear direction. Can we get a clear direction on how we can have a clear way to collaborate? Because sometimes, in my experience, is that we try and assist so that there's just not a situation where we are all saying the same thing with different voices. So for instance, we work on we have parenting programs from our organization. And when we learned that the Department of Education is also introducing parenting programs in the communities, we wanted to, work together and assist in that end. But it's not so easy to work together. For instance, it's just difficult to get the conversations further. You will send an email, you won't get responses in time, and it's just us saying, we are doing the same thing. We have been, doing this parenting program in the communities. We have some expertise that we'd like to share. Can we just work together? Can we collaborate? But there's a bit of resistance. So basically what I'm saying is, what is the clear direction? How do you get to sit together with the department and say, this is my 2 cents worth of information in this regard, and how can we take this forward? And again, with regards to the parenting program that the Department of Education has introduced, is there a budget? Because another thing that we learned when we were trying to work together with them was that Unfortunately, we've disbanded that parenting program. We don't have a budget for it. Thank you.
Thank you very much. Mr. Maimela, come on. Are you still, yeah, Ngapaka.
Good morning, Chair. Thank you so much for this opportunity. I think it's long overdue, especially for ECD centers. My name is Lenda. I'm from Alberton. I run a ECD, the Little Stars preschool, for about 11 years now. And I've just recently registered a private school as well, an independent school, which was a very tedious process. So my question is today, are there any plans for the department to formalize and standardize, support for smaller centers that are privately owned, but also serve a low-income community? Because I find that we get very excluded, in most things. When it comes to resource allocations, they will prioritize public schools before us. It's quite sad what we go through. And also, Ms. Klobatla mentioned that there is an intersectoral forum that basically wants to partner with us. So my other question is the committee considering having a provincial committee where the ECD centers will be informed on a regular basis, or even, involve us in decision makings so that we can share our ground level challenges and what we go through on day-to-day basis. And then my last one is compliance. Is the department having any plans to basically streamline or standardize compliance issues? Because you find that, I had to apply for my independent school 4 times, and I was declined in the process, and until I had to move into a property where I'm paying an exorbitant amount, that's when I was actually approved. So there's a lot of things we go through in the process, because we only want to be compliant. We don't want to run, centers that are not as per the department's norms and standards. But we also find that the department is not working with us. There's also exorbitant amounts that are required, like for your instance, for the zoning certificate and things like that. It's quite demotivating, I must say. I've been in the industry, I love and I'm passionate in serving kids, but sometimes, you wake up and you feel so demotivated when you're going to face obstacles from a department that is actually supposed to be supporting us. Thank you.
Thank you very much.
Thank you, Chairperson, and good morning to everyone. My name is Regilane Victor Maimele from the Association of School Governing Body, Contribute a Hand in Education. Chairperson, thank you very much for giving us this opportunity. When this program of ECD started, I still remember vividly, it was way in 2011. When it was introduced into the schools. And the aim and the objective, it was like 2018, all the practitioner or practitioners, they should be qualified, RQV 13 something, whereby they were given stipend by then and requested with the school governing bodies to contribute at least to meet them halfway from their stipend. By 2020, 2021, the circular was sent out to say, now all of them, they've been absorbed. Now they've been paid by the department, like educators. Coming to the fact that some of the schools up to date, they are still making the grade R's parents to contribute or to pay the funds, of which it was supposed to be not a penny. And coming to the issue of recruitment I still believe and understand that there's nothing has changed. The only problem is that the facilitation and the monitoring, that's where the problem comes in, to say whatever the program is put in place, when the opportunity arises, indeed, the SGB, they become victimized or undermined, simply because at first there was a School of Leadership and Management, of which it was Matthew Goni, where they were tasked, and I don't know where the ball has been dropped, to even go all out to check and motivate the crashes to comply and to become the feeder of the primary schools, those who are capable and with their compliance and everything like that. All that I just need to, honestly and truly speaking, to compliment the department of their vision, even though somehow the problem is that the facilitation along the way is no longer going according to the plan. Hence, when you are implementing to others or to some, it feels like you are changing things, but whereas it's an ongoing process and progress. Thank you very much for my 2 cents.
Thank you so much, Ntate Maimele. Let's take one more hand online. Robin Winnert.
Yes, thank you. I put something in the chat there where I just thank you very much for the presentation, and I'm just asking if we're able to get specifics on the finances, how much money was allocated this new 24 Rand subsidy, how much was allocated to the province in this period, how much was actually received by the province, and actual amounts distributed to date. Just so we know as a benchmark where we're going as a province with our finances. Thank you very much.
Okay. Just the last 2 hands, and then we'll then get to the responses.
Thank you so much. Firstly, I would like to say thank you very much to Honourable Mhlongo. I'm Lisa from ECD Upliftment Projects, and when we knocked on your door, you opened and you listened. So thank you so much for today. In saying that, I would like to just revert back to what the 2 ladies said. One is in collaboration. A lot was mentioned about collaboration today, and we find that there is a big need for collaboration, especially with service providers at grassroots level, whether it be NPOs, institutions, service providers, or professional businesses. There's a lot that is happening at grassroots level, especially with regards to compliance. We specialize in compliance starting with the municipalities at town planning, and we understand the difficulties that involves in getting compliance at that level. You know, also with touching based on what the second lady said is the challenges that it involves in getting that compliance for your ECD center. So I would like to know how closely you have built a relationship with the municipalities in actually trying to streamline, you know, the compliance process, and what are the discussions that have been held with the various municipalities? Because we currently work throughout 6, and we see that they do change and they do vary, and there are certain discrepancies from municipality to municipality, which makes things very difficult for our ECD centers. So I'd just like to know how far are you in those discussions, and have they been included in many of your discussions? Thank you very much.
Thank you.
Thank you. Good morning. And yeah, thank you for this important engagement and bringing us here. I wish there were more people, but I think the people that are here are really invested in this discussion. So yeah, my name is Ruth. I'm also from Grow Great. Our organization is really focused on the first 1,000 days, so not from birth to 2, but actually from conception so all throughout pregnancy until the age of 2, which we know is when the baby's brain starts to develop from day 1. That brain is developing, and by the age of 2, 80% of the brain has been developed. So it's a crucial time where we can really make an impact in that child's life and of course then in our community's life and in our country as well. But over a quarter of children under the age of 5 are stunted. And our president spoke about that at the 6th Social Justice Summit recently. So a stunted child has a stunted brain. Their brains do not grow well, they do not do well in school. And I would say that, these poor ELOM results are really a result of stunting to a large degree. And I think so for our organization, we start right from pregnancy. We have community-based antenatal and postnatal classes in communities across the country. We've been going since 2018. We've reached over 65,000 moms and babies through our groups. And our mission is to really start from day one to make an impact. And yes, in pregnancy, it is maybe more the Department of Health's mandate, but there is a big early learning opportunity during pregnancy already. So one of the things that we focus on in our classes during antenatal is really trying to get parents, particularly moms, to start thinking about how they can engage with their children when the child is born from day one. How can they help the child learn through play? How can they start reading to their babies already? And really prepare that child for when they enter the ECD. And then you also have a more engaged parent so that when they enter the ECD, they're involved in their child's education and learning, and they can be really great partners within an ECD. I know there's lots of issues around parents just dropping the kids off and leaving and not being involved. And we're really trying to galvanize, involve parents from day one. And so I think what I wanted to find out was, is there anything that is happening from day one, from conception until birth? We heard about birth till 5, but so much of the brain is already developing, and so much can be done to make sure that that mother or that parent is the first, literally the first teacher of that child from day one. And I think to Val's point around collaboration, we are there, we're ready to support in any way possible, so that's my not really a question, but a comment. Thank you.
Okay, thank you so much. We're going to take the last comment online, and then we'll give over to the department.
Thanks. Thanks, Chair. It's from Mario Clausen, just a follow-up from Robin's question. How is the department progressing with spending of the ECD infrastructure support grant, and what challenges they are currently facing and mitigating these challenges? And then from Jenny Peterson, on behalf of Montessori, the efforts to address the ECD crisis are commendable, as the situation is quite severe. Is there any opportunity in the near future for collaboration with Montessori training centers to enhance skills for ECD practitioners, both in curriculum development as well as practitioner skills? Thanks, Chair.
No, thank you very much. I think a lot of what we are hearing today is collaboration, collaboration, and collaboration. And that is quite an important aspect, because we know that education of a child is not a one-faceted entity or something that belongs only to one person and does not belong to the Department of Education only. Without necessarily answering the questions for them, I just have a few comments also to make that we do commend that finally there is some grant or subsidy that has been allocated to the mandate of the ECDs in the Department of Education. And knowing the work that you have done thus far, we do know that our people are going to benefit from it. Secondly, I think there's an importance in terms of community-based as well as private ECDs coexisting as well as working together, and the collaborations that all the stakeholders that have spoken today are raising. And then I really want to commend one point that stood out for me. I'm very passionate about learners with educational needs. So when you said that there's early identification of learning barriers so that there can be early interventions, MEC, that is an area that is very important, because we can see of late there are a lot of children that are on the spectrum, or children that have educational needs, but to a certain extent parents don't know what to do, how to identify, and how to assist those learners. So it's an important area for the department to be dealing with. And then in terms of capacity building and the professional development, that is another area that I think is very important in this sector, because at times we have seen it as a sector wherein children are taken to someone's yard. They're just basically in a babysitter, a fancy word for a babysitter, but everything that is being taken to ensure that there is professionalization of this sector is something that we see as an important aspect as the committee. But with that being said, let me give over to the department through you, MEC, so that you can be able to respond to the comments.
Thanks, Chair. Good morning, colleagues here in the hall and on call. Maybe let me start with the officials to respond, and then if there's anything, then I'll come afterwards. Can I do that through you, Chair? Thank you.
Thank you, Chairperson. Good morning to the MEC, colleagues online and the colleagues in the room. My name is Albert Cheney. I'm the Acting Head of Department for Education. I'll start with some of the policy issues, and Director Tlobatla will then deal with a lot of the operational things, and I'll also assist her, and then obviously the MEC would also address some of them. Let me start with what we've been able to do. When we inherited ECD, we took over 1,250 registered sites. That was all. And in the space of 2.5 years, we now have 3,500 registered, with a further 3,000 who have registered with the intent to comply. That leaves us with about 4,000 that are not interacting with the department and who we know are in existence across the province. And that was based on the survey that was done nationally. So I think we're making progress quite rapidly compared to when it was under social development. But we're also dealing with a need for transformation of policy. The fact that almost 8,000 were operating without the regulatory framework or outside the regulatory framework for various reasons is and was concerning. So it is in our interest to make sure that the more we can bring people into compliance, the better it is. So let me deal with the first point. The issue of municipalities and the ordinances that are there, local laws, is difficult to amend unless it is amended at a political level, not the people we deal with. The people who apply the ordinances are middle managers mainly. And so we now need to make sure that we are dealing with the MMC and the senior management in municipalities to do this change. We, as the education department, when we build schools, we are dealing with the same challenges. We don't have different challenges to any ECD. We are currently sitting trying to build schools and we don't have the approvals from municipalities. We have built schools where the municipality is not giving us permission to occupy. And it's for the same reason, that the rules vary across each of the municipalities. So technically we've got 14 sets of rules. And the only way we can do this is through the political sphere. We need to make sure that we put in place a policy review mechanism that produces a common set of ordinances that each municipality must consider adopting. And that is with a view to becoming a bit more transformative about that. That does then require the Department of Education nationally and in every province to develop what the compliance framework should look like. Because if we're giving the signal of what we want to test, then municipalities must also help us respond to that set. And that's the work we're trying to do. It's a very difficult terrain. you know, we can say we get a good response from Ikuruleni. 3 months later, we don't. Then we go to Tshwane and we find that over 150 ECD centers have lost their compliance, and then they don't have the time to upgrade those things. And so we have to deal with that on an ongoing basis. So the compliance one, I think for me is important, but it requires lobbying at different levels. And I'm not too sure it may be necessary at some point for the Department of Education through the Department of Cooperative Governance to actually table a proposal to SALGA. And for SALGA to intervene in that particular process and to help us. The second issue I want to deal with is the promulgation of the Basic Education Laws Amendment Act. And what it does, it says that grade R is now a school-based program. Now, when we were dealing with this, we did take into consideration the fact that grade R and grade Naught is offered in a large number of ECD centers. But the minute it became a school-based program, particular imperatives kicked in. One, is the person who is teaching grade R qualified? Are they implementing the national curriculum for grade R? Are they dealing with the notional time? And are they complying with the assessment requirements of the curriculum? Now, if we look at that, we currently don't know what is happening in ECD centers around grade R. I think Gauteng is the only province where we've attempted to know what is happening. We set out a survey in June, July, asking every single ECD practitioner teaching grade R in ECD to complete the form so that we know what their qualifications are, or what they're complying with, and so on. I think we are gaining ground, but we won't close the system. We will continue motivating more and more to comply with that. So we don't know what is the qualifications of the ECD practitioners who are teaching grade R in private ECD. It has not been a requirement for that disclosure. And now we're doing it as a survey to at least get a sense of what that is about. So when they declared it to be a school-based program, then technically what kicks in is that the learner doing grade R must be either in a public school or an independent school. And then we had an interpretation, and we're also waiting for DBE to give the clarity. And the interpretation is, if we allow ECD centers that are complying to then register under 2X, can they continue with grade R? Which means an ECD will not only have to register under the Schools Act and those particular provisions, they will have to register under the regulations for the registration of independent schools. So we are trying to get that interpretation. And then the question that we have, how do we then get these ECD centers to comply with the registration requirement of independent schools? Because the requirements for independent schools are more stringent than the ECD centers. Because the ECD center not only has to register with the department, they would have to register with Umalusi as an assessor. So it does get more complicated, but it's an option that lays on the table as a way of also reducing the pressure on the department to create additional spaces. So it would work in our interest to make sure that we are able to create those particular issues. Then there is a document called Mr. Tech. and it is not gender biased in any way. It means minimum requirements for teacher education and qualifications. And they specify that we would require an NQF level 6 diploma or an NQF level 7 qualification. And that is the minimum requirements for an ECD practitioner. So Mr. Tech is technically a set of regulations that guide all the universities on the design of the degrees and qualifications that they offer, and that indirectly becomes the minimum requirements. So just as on a side, I mean, NQF 13, which is a matric plus a 3-year qualification, was the minimum requirement for a teacher in a school. Nationally, that has now changed to NQF level 4, matric plus a 4-year calculation. And so those things are always moving. What it does do is it does say who is employed in the sector at that point in time are still in protected employment. So that is going to be the minimum requirements. I'm not too sure where the other province got the issue that if the grade R is in a private site, the rule wouldn't apply. Because at the end of the day, whether they're in public, independent, or private ECD, the conditions under which children are doing grade R is still a compliance matter of the province. And the province doesn't have the discretion to deviate from that particular policy. I don't know the exact figures on the financing, but what I can indicate is we got 350 million as an additional allocation in the adjustment process, which is what the minister had indicated in the medium-term budget policy statement and the budget speech earlier. Those monies simply allows us to maintain current, the current number of beneficiaries at 24 rands a head. What it doesn't do is it doesn't give us additional money to expend. What we would need to do to access the 10 billion rands that the minister has set aside is for us to write a motivation to DBE to motivate for the expansion of ECD in terms of the number of qualifying beneficiaries. And that means that the minister will then release the money. So the money is technically in trust, and it is based on the demand patterns that the DBE needs to motivate for. What we can also indicate is that besides the grant, there is an equitable share portion that the province is spending in this regard. So I think we can provide the numbers. It will be tabled in the adjustment budget, or has already been tabled in the adjustment budget. I'm sure we'll be able to share that through the committee. I think the other issue would be, I think I've dealt with all the policy issues, and maybe let me hand over to.
Thank you so much, Honourable Chair. Thank you, MEC. Thank you, HOD, and all the colleagues in the meeting and on call. Thank you, HOD, for clarifying the policy issues. And just to emphasize that then we implement what is in the policy. And so the first issue I want to address myself to is the issue of collaboration, because it came quite a number of times. And I think in the presentation that I made, I emphasized the issue of collaboration, and I did indicate that we have seen the gaps and we want to really close the gaps. And where there has been frustration in terms of collaboration, I think that is exactly what we were referring to when we're saying we have seen the gaps. And we also recognize that there is so much good work that is happening on the ground by various organizations, and so on. So we want to partner, we want to work together. And what we have set ourselves to do in the beginning of the year, actually we have a meeting that we have set for the second week of February, where we will be finalizing our plans. And then in March, we want to start, involving in everyone. What we want to do, we want to map all the partners, the NGOs, and the type of work that they are doing, both at district level and at provincial level, because others are working across 2 districts or 1 district and so on. So we want to map that and the type of work that they are doing. And so we have that plan. We're working together with our strategic partnership. They will be facilitating all those meetings. For us, we have already had 1 meeting with the business, like your First Rand and other business partners. So we want to take the service, the NGOs and other partners, and do the whole ecosystem, and recognizing each and everyone's role and coordinating better. I mentioned that. So with regards to collaboration, we are on the same page. We want to make sure that we have a working collaboration, and a collaboration that is sustainable for the province. So all those questions that relate to collaboration, I'm covering them under this comment. That definitely we want the same things as you are as a province. We want to do that. So the question, even with the issue of how you become how you collaborate and all of that. I'm hoping that a chair from this meeting, we will also get the details of those that attended in this meeting, so that we can compare with our database to see if we have other people that are outside of our database, because that would assist us a lot. And then I want to move to the issue of the selection criteria for the training on NQF level 4. So how we do it, we distribute, because we take 500 in a cycle of 18 months. So we divide that and distribute to each province, district. And then each district, if district A gets 10 and this district gets 12, this one gets 14, and so on, depending on the size, on the number of ECTs there. Then the districts would then work with the EHPs, the social workers in the municipality. And that collaboration also looks at which ECTs are still having people that are not qualified, and they bring them forward to the province, and that's how we get that training done. Because we're avoiding the issue of saying apply, and then because we were getting people who are not in the system, in the ECTs themselves, who are outside, and we didn't want to leave people who are in the ECTs and go outside. So because that money is for people who are in the system already. Let me address then the issues that were raised by Member Mkhwanazi. That I think the issue of qualifications, the HOD has indicated, but in terms of the total number in the class, for a grade R class, it's 30 children. It's 1:30. And then for anyone below grade R, those are I just don't have my Children's Act with me, but they are indicated in the regulations for the program, and it would say like children who are birthed to the 2 years, there must be 6 in a class. Those who are 2 years to 3 years, there must be so many. So it differs. And it is also outlined in the certificate, registration certificate, because it is the EHP that makes that determination from the municipality. So it would be outlined in the certificate that they get, the ECTs, that they must have so many in that class. But the grade R is standardized at 1:30. And just the issue of, just to clarify again with the because most of the things that I presented, there was actually birth to school-going age, in the ECD sector. But as I indicated earlier when we started, that we also have the portion of grade R. And grade R, there's grade R in public schools, there's grade R that is taking place in the ECD centers. Now, the grade R in public schools, what happened was that, and it also ties to the question that was asked by the gentleman over there, we started, I think it was in 2002, the process of grade R universalization. And grade R, we started introducing grade R gradually in the schools. And in that process of universalization, the Mr. Tech at the time in 2002 had not yet made the determination on the grade R qualification. That came in 2015. So from 2002, it was anybody and everybody coming in the system and teaching grade R. The SGPs would decide whether I bring my daughter or my aunt's child, my niece, my nephew, and so it was all of that. When Mr. Tech came into being, then we started the process of taking those grade R practitioners in the schools. We took them through and enrolled them for a diploma in grade R teaching, which is NQF level 6. And from there on, every time we've been enrolling those grade R practitioners because we knew we were preparing for when grade R becomes compulsory. So to date, we have 3,100 of those that have qualified. They either have B.Ed in foundation phase teaching or diploma in grade R teaching, and they've been, converted into post-level 1 in the public schools. Now remember, those ones are in the public schools. With the ECDs, they are privately owned. They are not employees of the department. So they are the employees of the ECDs. So there the ball game is different. So in the schools we have done that. And so I'm not too sure about the new document that the member was, the honourable member was referring to, but I just need to indicate that with regards to the employment of grade R practitioners, up to this date, like today, it has never been in the formal processing, like, applications like your grade 1 teachers. It's gonna start in the next financial year, which will be for the first time. So grade R has been employed differently, but now recruitment and selection, they are working to put together grade R as part of all the grades in the schools, so that recruitment and selection of grade R practitioners or teachers would also be done the same way as grade 1 up to grade 12. So it's going to be a new process. There's nothing for grade R that is happening currently in that space of recruitment and selection. So when they do the training of SGPs, they would obviously include the grade R teachers as well. Even when they issue out what is it that they issue out, the post-establishment and then recruitment and selection, they also issue out the circular. It will also now start to include grade R. So far, it hasn't been including a grade R because it was not a compulsory grade. So I think the next question on the in mixed ages and including grade R and standalone ECTs, HOD has spoken to that. And I just want to emphasize that we do have a steering committee that is looking at the implementation of compulsory grade R. And in that steering committee, we are looking at what will happen, what should happen with the grade R that are in the community-based sites. How do we, deal with that issue? And it's not a simple thing. It's very complex, but all these things that HOD said, we have different proposals that are still on the table, but we are still waiting for the regulations from DBE, because DBE is dealing with the regulations regarding that. So we are still doing that. And Grow Great, it would be great to partner on the parenting program. Yes, we don't have a budget for that because we use our own social workers to do the training and so on and so on. So there's no like a budget specifically for parenting program. So partnering is also going to be helpful as well. And that would, like I said, the direction and how we collaborate, all of that will be communicated. There was a question regarding from Little Stars that any plans to formalize small private ECTs. I think the way there's just one way of formalizing is the registration that we are doing on the e-cares, and then in that way you are in the regulatory net, and then we start working together. We don't have a specific way for private or community-based. It's just the same for everyone. And I think I also need to correct the fact that the fees for rezoning and whatever, it's not from the department. It is from the municipalities, according to their bylaws. And we also have serious problems that the bylaws are different for each municipality, but from where we are sitting, all we normally say is that, how do we work within what we have? Because we can't sit back and say, the bylaws are different, therefore we are not able to operate. We need to come up with a way of saying, how do we make it happen even though the situation is like this? Once the policy holders would be, doing the policy review and all of that, work must be done from our side. So we're working within what we have. That's why we are holding meetings with each and every municipality individually. So we understand the bylaws there, and we start influencing and in some cases it works better than in others. I can say in Ekurhuleni, we have even met with the MMC, and she called the meetings with the public, and we were, we had a fruitful way forward from those discussions led by the MMC. So it differs from one municipality to the other. And so we also want to welcome the focus on the first 1,000 days. We don't have a particular program. We work in collaboration with Department of Health on the road to health, which includes the first 1,000 days, but there is nothing that stops us to actually come together on that as well. With regards to the maintenance grant, so the maintenance grant is, allocated to the department, to all the provincial departments, to ensure that the ECDs that are on bronze, remember when they are on bronze, they are not compliant. So what we do what we call the registration readiness assessment. In the registration readiness assessment, we check what are the problems in ECD. Do they have good infrastructure? They just need maybe what is this signage, they need a fire, that thing. Yes, fire extinguishers and all. We put together a health and safety pack we provide. If they need infrastructural intervention, then we put them on another list for the maintenance grant. And so that's how we do it. So, but then also it is dependent on the availability of the budget. I think this year we have about 65 ECDs that are on that program. And so there is progress that is happening there in the next financial year. So we have a number of them. I mean, we have, like we said, we have more than 4,000 that have bronze. So all those, when we do readiness assessment, a number of them, they need infrastructure assessment. So we will be taking them bit by bit into that program. So yeah, that's how where was I now? The infrastructure or the maintenance grant is utilized. So it has two components. It has the infrastructure itself and the health and safety component, so that we can have the quick wins as well on that thing. the issue on the SGB associations, I didn't get quite well what is but what I know is that in the previous dispensation, the SGBs were responsible for employing the Grade R. Moving forward in the next dispensation, as Grade R is now compulsory grade, it is part of the whole recruitment and selection, and however the recruitment and selection is done, it will be the same for all the grades. And moving forward, the fee-paying schools Grade R will pay. The no fee-paying schools, Grade R will not pay. So everything that it's happening in schools for Grade R will also be part of that then. HOD responded to the finances, and yeah. And thank you for all the comments that we're taking, the comments of saying the good work, of recognizing the good work that has been happening in the department. And I must say that we're not a big team, we're a very small team, and we are biting this elephant bit by bit. And our modus operandi is we will get there, and we don't get disappointed, we don't get tired, we will just move. And these engagements, they help us to sharpen our saws. We know that the issues are we're still scratching the surface. The ECD as a sector is a huge sector. It's no child's play, it's massive. And so that is why we are saying our focus is going to be on the social compact, and so that we can unleash and make sure that we cover a lot of ground through that. Thank you, Chair.
Thank you. I'm sorry, I want to make a clarity. If SGB is part of the school, when Grade R also is under SGB. Remember when we started Grade R, it was SGB they were giving powers to make sure that SGB is part of the school. Now, the association, and then those are the people that it's like a union of the parents. Yeah, and then if we must know the association that is playing a big role, because also the association is what we call, is some of those parents, and then they are representing other parents if they have more cases. Thank you.
No, that's fine. I think it's Honourable Member is clear. Look, if a child is at a school and the parents are part of the SGP, they can get elected and participate fully. So I think that one is it's not that when they're in Grade R, there's a special dispensation in the school. The dispensation is the same for all of them. Look, the HOD and Director Robata really, I believe they've covered all of the questions, because obviously how I arrived. But what I can add, colleagues, is that we've come far with this sector as a department, and I can't overemphasize what we received. You know, in Africans, what is this thing? Foot steward. That's what they gave us. We arrive, there's a transition, and say, yeah, take and go. And that's what we found. You know, so now we have to develop that sector to be on par with the formalized basic education sector entirely. And that requires time. As a department, I mean, on its own, the Act, we're operating through the Children's Act, you know, and we need to move. We need to formalize an act that specifically talks to ECDs, and this is policy. These are policy gaps that we found. But currently at national, we've begun to prepare for that particular transition and its proper formalization. So that one I want to assure the practitioners here and online that as basic education, we are moving quickly to make sure that we really get this sector right. It cannot be right that, for instance, I mean, you speak about qualifications. In developed nations, to be an ECD practitioner, you need something like a master's level degree to really even begin to be considered that you are ready for this very important stage of development in a child's life. So this is the steps. These are the steps that we're undertaking to make sure that we formalize. So it's not going to be something that is quick. It's not going to happen immediately, but there are steps that we'll be putting in place as and when we move forward in the formalization of this particular sector. And I'm happy that in the time I've arrived, there's a lot of collaboration. Basically here, colleagues, it's all about, Chair, continuous engagement with stakeholders so that we don't leave them behind as and when we progress. They don't get to see just gazettes that there's this move that has been taken by government, but also bring them on board so that every step we take, they are able to give us suggestions in how best can we move, because currently they are the ones who are going to be affected by every single policy decision we make. So, and that's for me, that is a key area. Thirdly, one issue that we are working around in the department, the HOD will tell you, and Director Global, is the structure. Currently, the structure is very small to really service the sector. For me, ECD should be at the level of Deputy Director General as a branch in the department because of the magnitude that it's serving. But currently, we have a director, not even a chief director, and not even a DDG. But we are working around the issue of the structure, of which that will enable us to better service the sector, to better respond to the sector's need. So we've already started that process. We have put it in place so that we are able to support. The issue of local government, it's a big problem across. Director Klubata has really put it correctly that some of the requirements are not, I would say, which for lack of fair. You know, some of the requirements, I mean, for the city of Johannesburg, where we are, for you to actually even form part of compliance, you need architectural approved designs. Now, for somebody in the township, and you know how this sector came about. You know, it's a welfare sector that came about to intervene for parents who were working so that then they can somebody look after the kids while they were gone. So now you want those people who, and most of the time they're in the back yard. Now you want this particular requirement for you to even get approved. It's not right. And I know that passionate practitioners have really gone out and really tried to comply. But in some instances, even the municipality, over and above that requirement, they don't even support or agree. And remember, the cost of getting architecture is not, it's a specialty profession. So these are the discussions that I have with the mayors through our IGR forums. Through the IGR forums, I have had these discussions with all the metro, in particular metro mayors, because that's where the biggest challenge in terms of compliance comes from. But also at the level of municipalities, beyond the IGR of the executive mayors, people who are responsible for this sector is social services. And I don't have social services in my IGR. I don't have meetings with social workers, social MMCs or mayoral committee members responsible for. Those are a social development. So those are some of the gaps. These are gaps that we are addressing at the level of policy. But this is in the education sector. However, in municipalities managed by social development. So there's no engagement between myself and them. Yes. So this is what we're currently. In fact, if it was up to me, this responsibility of the sector should be moved out of municipality really, entirely, and be brought to where it is in education, because it's an education sector. It's a school. Remember, your ECD, it's a school. So it's not a welfare institution, it's a school. So if we move it, it should be moved entirely. That it moves out of municipality, it comes up to the level of the provincial education department, and it gets managed and supported there. But overall, colleagues, I think I appreciate what I was able to gather, especially from the private ECDs, and mostly because if you look at grade R, the private ECDs that are professionalized, like Montessori, etc., etc. I'm giving an example. I'm not promoting Montessori. I know you are different companies as well, so I'm giving an example that there are those that you know that they are fully compliant in supporting grade R. That even when they move from those children from grade R, and then they join the basic education system, you know that they've gone through the proper support. But there are those that they don't have the same infrastructure in terms of practitioners to support that particular grade R, but they do have it. And those kids, when they come into the system, they move with a bare minimum. It's a bare minimum, what we start with. Yeah. So these are the gaps that are there that we're trying to close, and we're working to close. Because currently, of course, that it's grade R is compulsory, it's in schools, but there are schools that don't have space for grade R. We do have schools that don't have space at all. Primary schools. I think there's about how many? 67 schools. 67 schools. And it's huge that now. 67 schools. So in that case, and also even the schools that have grade R, in terms of capacity, is not even enough to support the requirements that are needed in terms of capacity or classroom space. There's not enough, because you can't take grade R learners and put them in mobiles, like as if they are putting other grades. These are cordoned off areas in our schools. So the collaboration with the ECD centers that are within the school, it's important that the school has that particular relation as part of the feeder centers. But feeder centers, obviously, that means that they should be compliant to really be recognized as feeder centers to the immediate school that is there. And that goes for both public and private schools. Chair, I didn't want to take much time, but I thought I should just reflect on how far we have come. And I think, colleagues, we need to appreciate the effort, what we have done. I mean, social development gave us around 120, is it social workers? 111 social workers to service over 10,500 ECDs that research has given us. Literally, if they can go to one ECD a day, they will not even complete those number of CD in a year. So this is we got that small capacity for this big work. But we have recognized that as part of, we've been down this road as education department. How we started many years ago when we were setting up the education department to what it is today. We've got experience, and that's the path that we're also taking with the sector. So in the next couple of years, I believe that we should be at the level of the other, I would say, first world countries, developed countries, Finland, Singapore, you name them. Because obviously the learning experience and are there, on how best to really get our sector, this area of education right. Thanks, Chair.
And the collective, I think that the responses that you were giving were very important, but I think Director Tlobata, the biggest thing that I'm taking out of this is you requesting that we share the context of these stakeholders who are here with today, because at least when they are in your database, then you are able to have those interactions further with them, not just them coming to us as a committee, because yourselves as the department are the implementing agent. And really, I think, MEC, what you are mentioning on the importance of lobbying for the ECD to be a wholesome sector that is in education, because there's no education in municipalities, is very important, and that the committee will play its role in terms of the support that we must do in lawmaking to try and push for some of those things to happen. Now, colleagues, I know that we were meant to go to lunch at 12 o'clock according to our program and receive a presentation after lunch. Now, the organization that is requested to do a presentation has not sent us their presentation. Have they sent now? They've just sent. Okay. So I'm going to request colleagues that, because their presentation is not too long, that we just take it in 10 minutes, and then we are able to release yourselves, the department and the colleagues that are here with us. If you can just indulge us 10 more minutes, MEC. Thank you. Do more. I do believe that your representative is Ribotile Matuana. If you can just then continue with the presentation.
Thank you, Chair. I am here. I'm not sure if I can share on my side.
We can hear you.
Yeah, I'm saying my presentation, can I share it on my screen and control it from my side, if
Yes,
that's fine?
That's fine.
Okay,
Please.
thank you. Thank you so much, Chair, Honourable MEC and members of the committee. We do appreciate the opportunity to share some of our work with colleagues in the sector. And really the premise of why we requested to present is just to really, heed the call of action to collaborate and to make as much network opportunities available for all of us here who are working hard towards really improving and strengthening the ECD ecosystem. As the chair has alluded, my name is Ribotile Matuani, and I am the regional ECD coordinator for the Dumo Foundation. I specifically support implementation of programs within Gauteng province and some within Northwest, specifically in Rustenburg. But for the premise of today's presentation, I will just give an overall general view of the work that we do as the Dumo Foundation. So perhaps just to move us along is a bit of history on our foundation. We are historically the CSI department or unit that falls under RCL Foods. That is one of the largest food manufacturers in the country. And this is the history of the foundation, that between 2017 and 18, it was agreed that it would serve and
just a second, Ribotile.
Yes,
the way it's appearing on our side, we'd prefer if we share it from our side so that the screen can be bigger. Just
Okay.
a second, please stop sharing your screen so that they can share from the side.
All right.
maybe you can talk to it whilst Tabo is trying to share.
Okay, sure, no problem. I was just going through the history of the foundation and explaining that historically we were the CSI unit of RCL Foods, and between 2017 and 18, when the foundation was established, it was agreed that it stands to create greater impact in the communities as an independent entity. So currently, though we do have the support of our corporate founder, we are operating as an independent nonprofit. And essentially, our work really rests on making the lives of young children better. And how do we go about doing this? As a food business, the initial sort of approach was to look at how we can strengthen nutrition for young children in communities. And so, in response to this, and as a way of entering into communities, we approached RCL to support us in developing a porridge, a breakfast porridge for young children. And this is now what we provide to around 38,000 children across the country every day, through various partners who help us to get this to children in our community. So this was our first point of entry. But further to that, we realized that there are other areas, with ECD being a holistic service, we realized that there are other areas in which we can leverage existing resources and assets in communities to bring services to young children and their families. And so, with guidance of the National Integrated ECD Policy, we looked at the areas that I guess would be considered to be minimum viable packages of support. What does a child need to thrive where they are? And that's how we developed our approach, which is based on implementing programs within different baskets of services. I can go through those baskets just quickly. These include food security and nutrition, parent and caregiver support, maternal and child health, early learning through play, child safety and protection, as well as the first 1,000 days. This also includes infrastructure and services, enterprise development, capacity building, and leadership development. So, because we are also, as Mampumi alluded about her team as well, we are quite a small organization with a very small team ourselves. We do not have the capacity to implement various programs within these baskets of services ourselves. And so the model that seemed most viable was for us to approach local implementing partners, people who really are working in this sector, who are well knowledgeable about their communities, to support the work that we are doing, and to collaborate and pool the resources that we all have to really impact the lives of young children and their families. So what this means is that currently, across the 9 communities that we work with across the country, we work with various implementing partners. And these, like I said, are local community-based organizations who have a well of knowledge about the work that happens in the communities. They have a well of knowledge about the needs of young children in those communities as well as their families. And so, through this entry point of providing porridge, breakfast porridge, we go into a community, and the first thing we would do is we would do a scoping and assessment, where we really try to understand the lay of the land. What are the needs? What is the status of the children and the families? What services are available? Who is working there, etc. And we use that data to inform the programmatic interventions that would be best placed in that community to make the most impact. But again, I must emphasize that this work rests on collaboration. It doesn't just depend on our resources or our knowledge. It really rests on who is there and who's willing to come to the table and support the work that we want to do. So within that model, and the limited capacity we have, we would then identify various partners who are implementing existing programs or who perhaps want to initiate certain programs, and we collaborate with them to see how we can bring a service to the community. I'll make an example. We actually have one of our implementing partners in the meeting. Early Care Foundation does a whole lot of work for us in Rustenburg, and they are implementing programs within the parent caregiver support basket, as well as the capacity building and leadership development basket. So we work with them to ensure that our practitioners are getting the skills that they need to really impact young children in the ECD centers. And they are also helping us with the distribution of our porridge to our ECD centers in Rustenburg, as well as engaging our parents on our parenting program, which is Eat, Love, Play, Talk. So that is just an example practically of how we would work with a partner who already does similar or aligned work in a community. And moving forward, we also, because we understand that this partnership approach takes a lot of effort in terms of all the different partners and stakeholders that we possibly can work with to bring services to young children. We have gone on to convene what we term technical committee meetings, and these are really at a district and local level, calling all the people who are working in that community monthly to really set the agenda and have a clear direction of what is it that we want to achieve for young children in this area. How do we support the ECD ecosystem in this area, so that it's a bit more structured and organized, and we don't have a duplication or waste of resources, but that we are aware of the synergies that exist and how we can support each other as we do the work that we do. We tend to invite and really, we always encourage the participation of, our DBE colleagues. We also encourage participation from other stakeholders like DSD, like DOH, but we also really stress the importance of our civil society organizations who are working there to be part of that committee, because it really helps us carve out where the gaps are, what are we doing, and is it working, etc. So those technical committee meetings have become a consistent structure within our communities, and this is where we really get to exchange information as stakeholders and identify what else needs to be done, where the gaps are. Parallel to this, at a level that really seeks to involve the ECDs themselves, we strive to involve them at the level of a young child forum. So this is where we invite our ECDs really to get information, and that's purely what we use that structure for. Each and every month before the year starts, we engage them on what are the burning things or issues they are facing, and what would they like to get support on, what information do they need that can move them ahead. And we go out and try and convene the relevant stakeholders to come and speak to them and give them information. I'll give another example of this recently is we are working in the Randfontein area and Boksburg areas in the informal settlement of Ramaphosa, and in Randfontein, the informal settlement of Zenzele. We recently went into a partnership with FNB Cares, their CSI unit, and they're offering financial literacy training to ECD principals. And we had them come to our site in Boksburg, where they trained close to, I think, 20-25 ECD principals. We also work with the likes of Grow ECD, who came and did a business accelerator for our ECD principals. And this is speaking now to a basket like the capacity building and leadership. So that's just an example of how we would collaborate at a community level with our counterparts. And through those structures like the Young Child Forum that I spoke to, we also try as best as we can to invite, and I think of late, and I'm so glad to hear some of the feedback that Mampumi gave on the mass registration drive. Some of the feedback we've had in terms of the needs for information have been around compliance issues and governance. And so in that instance, we really go out and try and engage our local municipalities to come and present on what is it exactly that is required from ECDs to get to the level of compliance. So that is how we would use a platform like the Young Child Forum. In other instances, it is used as a capacity building training platform, but it is really to bring closer to our ECDs at a community level, the stakeholders that generally seem far away from them. So that is just, in a nutshell, some of the work that we do. And maybe before I really summarize, or try to summarize my presentation, but perhaps before I end, is to stress that the approach of the Dumo Foundation, as I did mention, from a limitation of capacity, is to really display what collective impact can achieve. And as a foundation primarily born out of a corporate business, we also try and stress the role of all partners, including business in our communities, to contributing to the ECD agenda. And so outside of the stakeholders that we work with at government level, at civil society level, we also try and be a convening power to call on corporate structures to bring their resources and really see where they can fill a gap for ECDs at community level. And that's really the premise of what we do, is to demonstrate what this collective impact approach can really achieve for our communities. I'll think maybe I'll just, before I wrap up, go into some of the learnings that we've taken throughout our work. Is that, you know, it does help to have a shared vision. I know recently, I think it was last year, we signed an MOU with the National Department of Basic Education, and we've seen that that is really a great tool to align us on how we can be of assistance, but also for the department, as Mampumi alluded to, on partnership agreements, to really understand who is there and what exists and how can we all leverage off of each other's strengths in really creating impact for our communities. And really a big thing that we operate on as a foundation is around trust and transparency. We really, to our best, really are a partner that is open and willing to engage with anyone who really seeks to contribute to the lives of young children. And so trust is a big factor in our way of working, and that's what we've learned really facilitates great collaborations. And of course, familiarity with local context. And I think this is something that is known to all of us in the room, is that without understanding the dynamics of the local community, it is as good as shooting in the dark. So we do our best to really engage with the key stakeholders that work within communities and really have long-standing knowledge of these communities. And some of our challenges, I think some of the colleagues in the chat have alluded to them, you know, lack of buy-in and accountability. Some of these partnerships and projects take a lot of time to get off the ground. And for a long time, it can feel like you are really pushing against a brick wall. And then lack of time and resources. This, I think, in the NGO sector is something that we are all experiencing, especially in the current economic climate. And I guess at ECD level, we have had issues around investing in the ECDs and them eventually not you know, choosing another path or not really maintaining their commitment to their own empowerment, or in other cases, the high staff turnover of ECD practitioners once they've been empowered and they feel that now they are ready to move on, leaving the ECDs that they were part of quite vulnerable. And so those are some of the local challenges that we've experienced, which I think are not quite new. And lastly, just to add that though we are really serving the role of we see ourselves as a foundation that really seeks to bring the collective together at community level, we also do have a few of our own in-house programs that we've developed and that we share and implement across some of our communities. One of this is a parenting program, excuse me, and it's called Eat, Love, Play, Talk. And really this program seeks to also encourage nurturing care within parents, but from the lens of nutrition. So using food as a tool to really build relationships with parents and children. But given the reality, the socioeconomic realities of many of our communities, it's really to bring at a very basic level knowledge about how they can sustain themselves in the home with the resources that exist at a community level through food gardens, through home gardens, but primarily also just making them aware that you don't have to have money to be healthy or to have your children be healthy, because a healthy child is a child who can learn better. And so those are some of the things the messages we really emphasize with them through this program. And another one is our Repurpose for Purpose, which uses recyclable material to create in-class learning material, storyboards, and we distribute this widely through our partners as well. And yeah, I think I'll stop there. If there are any questions, I'm happy to answer. Thank you.
No, thank you very much, Rebotile, for that comprehensive presentation. If we can give her a round of applause. No, I think we must commend the work that Dumo is doing. You know, it's very important, and I think you touched on quite a number of aspects. But I'll allow before that. Let me apologize. We had indicated that the MEC is going on a sports program. That's why he was here wearing Orlando Pirates, and I was telling him that some of us are Kaizer Chiefs fans, so you must not come here wearing your sports. So we must just apologize for him. He had indicated earlier that he's going to a sports program as he's an MEC for both sports and education. But I think he had most of the presentation, Rebotile, even though we would have preferred that you were here physically to give us that presentation. I think that a physical presence is quite important in some of these events, especially for an organization that then is going to give us a presentation so that we can put a face to the presenter and also comment the work that you're doing. But I'm going to allow for colleagues if they have any questions or comments for you, but we did indicate that we'll share your details with the department. Colleagues, going once, going twice. Okay, I'll just make a comment that the MEC made whilst he was sitting here when you were sharing your stakeholders, and I'm glad that perhaps you then indicated that the Department of Basic Education, you signed an MOU with them last month, because he was sitting here saying, but this organization doesn't have education, they need partners, you know. So I think it's a way of him saying that they would also like to partner with you in the work that you are doing. I don't know if HOD would want to make any comments, or you are okay.
Thank you, Chair. Maybe to say we welcome partnerships like this. You know, one of the big problems we do have is that there are a lot of organizations who have got good ideas to want to implement, but they're not adequately resourced. And the department doesn't have a budget to fund those activities. What I was telling the director here is maybe just before COVID started, the Gauteng Education Development Trust did an audit of all the foundations and looked at the money that was earmarked for education. The largest percentage of the foundation's money is going to ECD. So it's something that organizations need to consider, is starting to approach foundations to fund their activities. And for us to assist in defining the work that contributes to a greater whole. And I think for us, that is the role that we can play. Thank you.
No, thank you very much, HOD. I think that's a very important aspect because many organizations would want to know which doors to knock on in order for them to try to find or get financing or funding for some of the work that they are doing. But really, colleagues, I want to appreciate all of you that have physically made it here today. I know it's December. I know that people are very busy. And I know that there's a lot of graduations, especially for people that are in the ECD sector, to have made it on a Saturday where there should be graduations. We really appreciate. But I'm going to request Member Mkhwanazi to officially do the vote of thanks for us.
Okay, thank you, Chair, for this opportunity. I would like to say thank you very much to all those who participated on also the presentation, those also in line did not able to come. That let's wish Chairperson next. The department must have a all database for all our what we call stakeholders. Yeah, but they can also use us to get information. They must have the information. Then next time we have full of house, not like this. Thank you very much for coming. I know it's Saturday and now it's also December time. People are busy shopping, but we are wishing all the best for until next year. Those who are gonna be traveling, I'm not traveling. They must go safe and come back well, and then we continue with our struggle. Thank you very much, Chairperson.
Thank you so much, Member Mkhwanazi. Indeed, this is our last activity of the year, but I would have wanted to also point out an organization in particular of people that came to us and said that we need to have this stakeholder engagement with ECDs, and I want to appreciate them for coming up with the idea, because it helps, you know, as government officials, that when you come to us and say that there is a suggestion of 1, 2, 3, then we are able to push for implementation. But we are hoping that this is only the first stakeholder engagement. It's not going to be the last one. We are going to be working with all of you, including other stakeholders that are in existence. I think we must just appreciate all the work that you do in the ECD sector, because we do think it's an important foundation for all of our children. Thank you so much. May you have an awesome weekend and have great, amazing holidays. The meeting is adjourned. Lunch is served, Tibos? Downstairs. When you get off the lift, you turn to your left. Thank you so much.